This is the Doctor Weighs In, and I am here with Jude Pierre-Louis, who is the Director of Strategic Innovation Development at Walgreens. Hey, thanks for being here.
Well, thanks for having me, Anna. I'm excited to be here. I work at Walgreens Healthcare Innovation, and I'm thrilled to be sharing with you what we're doing at Walgreens FindCare, which is a digital platform to help people find convenient and affordable care as a telehealth service.
And I'm just glad that you had some time for us because based on what we're going to talk about, you've been really busy.
Yes, we have been busy with everything that's going on. Information is updating on a daily basis and almost on an hour by hour sometimes it feels.
Yeah, so let's first of all, I want to talk about some of the expansion that you've undergone, any new services. And then I'm really excited to kind of dig into the app. So I downloaded it last night and found it very easy and cool. So I want to dig into that. But first, we can talk about, sounds like you have 2 new telehealth features and then at least 3 new services that Walgreens has done with some of the expanded delivery options and stuff.
Sure. Well, the app is an award-winning app, and we're thrilled about it. So our pharmacy app has been around for a number of years. Individuals can scan your prescriptions and have your prescriptions delivered to you. We have Walgreens Express. But more importantly, we also have Walgreens FindCare, which is a digital platform that makes it easy for users to find convenient, affordable care, especially in their local area.
So this is exactly what I wanted to jump in. So for me, what I have felt is that being in quarantine, there is new information constantly, and I've almost become numb to it. So when I want to recall it, I'm like, okay, where did I see that? Is that fact? Is that fiction? And so one of the things I wanted to do, if you don't mind, is start the call with, I'm sick, I'm at home, and I want to find reliable care. What do I do?
No, that's great. So with Walgreens app, well, what we have is a comprehensive offering. So everything from the initial consultation. So you're sick, you're experiencing some symptoms. You might want to jot down some notes in terms of what you're experiencing. But what we do in Walgreens FindCare is based on your geography. Once you open up the app, they'll list all the providers, depending on the based on the service or offerings that you're interested in. You'll be able to find a provider that's relevant to your needs, I should say. So from an acute care perspective, so you're sick, you're not feeling well, or primary care, you open up the app, the FindCare app. It'll list the providers. You select a provider that you wanna engage with, and then you navigate with that provider, and you are consulted. You may then be diagnosed, and you'll be provided even treatment. And the great thing about it is you can circle back and have your prescriptions filled at Walgreens. So one comprehensive, holistic view.
And with all the COVID-19 stuff now, you also have risk assessment and help that way, right?
We do. So one of the things that we've made available for individuals, we have a number of COVID-19 testing sites, and they're opening up on a daily basis as well. So we've recently made an announcement that we're going to be making available in 49 states. So in the app, once you click on the COVID testing link, you'll be navigated through a series of questions to understand, if what your symptoms are, and based on your location, you'll be directed to where you can get COVID-19 tested.
So I went on last night, and so I pretended like I was sick at home and needed reliable care. And so one of the things, just to so you download the app in the App Store, whether you have an Android or an iPhone, you go in there. I had a Walgreens, you have those little Walgreens cards, so it's not like I remembered my password and stuff, but that was easy enough. There were a little bit of growing pains in terms of requesting my username, and the email went to my promotions inbox instead of my spam or regular. Other than that, that was pretty easy. So One of the things I noticed is, do I have an option for 24/7 care? I noticed some of the service providers were open, say like 8 to 8. Is there 24/7 care as well on that app?
I'm hoping that you can hear me, and if I need to repeat, I'm more than happy to repeat. Um, so Walgreens, we do have some features that are 24/7, such as our pharmacy chat. It's open. You can chat with a pharmacist very conveniently any time of the day. Most of the services for our partners, they list their hours on their website as well. I believe some of them are available 24/7, but if you need to go chat with someone, you can also reserve time based on their availability.
Yeah, so how it works is when you log in, I'm kind of just outlining some of it so that people listening to us. So when you log in, you go in, you can actually use your current location if your location setting is on. If not, you just type in your zip code or wherever you are. And then it brings up a bunch of options. One of the coolest things that I noticed was that it lists cash price, and I'm really interested to know how you kind of made the decision to do cash price offerings versus in lieu or conjunction with health insurance.
Sure. Well, the cash price is the price that our partners or our providers list. We believe in price transparency, and what we wanted to do was make it easy and convenient for consumers to basically compare prices and weigh their options. And while it doesn't really matter if you have insurance or non-insurance on FindCare, most of these services, that's why we've asked for these providers to list their cash price. By the way, one of the neat things about recently what's changed is that a lot of the services are reimbursable from plans. So depending on your insurer and depending on your plan, you can get reimbursed for the claim.
And so how does that work with the pharmacy pricing? So if I pay the $75 for a visit, or I noticed one of the prices in my area was $59, how does that work with somebody without insurance? What kind of prices might they be expected to pay?
Sure. So the pharmacy benefit is a little different than the provider benefit. So each of our providers would submit the claim for that service, and Walgreens, once you've had your prescriptions filled, it would be whatever you would typically pay at the pharmacy, such as a copay. Perhaps it's $5, perhaps it's $2, or perhaps in some instances it's a zero copay, depending on what your prescription benefit is.
Yeah, and so I did so before this interview, I did a couple fact finding in terms of statistics and stuff. And I think one of the coolest things about this option is the statistic that approximately 28 million Americans are not insured, which is about 8.5% of our population. So to have a service that provides healthcare to folks that may not otherwise have it is really cool. And so what would you say, who is telehealth helpful for?
Sure. Well, telehealth has a broad range of services, right? So anyone who's ill, as you described, you provided an example earlier, or perhaps who has a preventive service that they're interested in, telehealth is a solution for them. We have a growing number of providers that are listed on Walgreens FindCare. Currently, we have 30 who treat over 100 conditions, and that number continues to grow. We also telehealth is also beneficial for individuals who have monitoring devices like remote monitoring blood glucose for diabetes, as an example, or asthma. We also have a partner that has a service for individuals with asthma where they could monitor their care remotely. So it's comprehensive, is the breadth of offering that we offer through Walgreens FindCare, and with the pharmacy app, just to reiterate, it's almost an end-to-end journey for the consumer.
Yeah, and one of your new product offerings or service offerings was I think it was 60 front-end products that are at the drive-through. What does that mean front end products?
Sure. So what we've done with the COVID-19 pandemic, what we've done is made it easier for individuals to pick up prescriptions, to pick up items that are on the front end via the drive-through. So this facilitates and minimizing exposure to COVID-19. So from a social distancing perspective, don't have to go into the store. You can have those products picked up at the drive-through.
So like Q-tips, cotton balls, things like that?
I'm not entirely sure of the complete
Okay.
list. There are others. There are others who probably fill us exactly what those lists are, but you know, certainly we're making it more convenient for consumers to shop during these days that of COVID-19 pandemic.
Well, this interview is timely because I actually avoided picking up a prescription through the drive-through because I needed Q-tips. And so I'm like, you know what? I'm just not going to go get the Q-tips. I'll just get the prescription. However, knowing this, maybe I could have gotten them all in one stop. So this interview is about 3 days too late.
Oh, no. And by the way, those for next time for your prescriptions, you can also have your prescriptions delivered. We've actually waived delivery fees so during this time. So that's also another option.
How far do you intend this? So when things go back to the new normal, will a lot of these things that consumers have become used to, you know, do you anticipate keeping a lot of the delivery options and things for into, you know, the near future?
Well, the delivery options, as far as the fee waiving, that I can't speak to, but the Walgreens FindCare, certainly all of those services will continue to be in place. So you'll be able to leverage and use telehealth services to talk to a doctor remotely, as well as for convenience and affordability.
And it sounds like a lot of people are starting to get the word about this. So I know your team sent over some statistics about the app being up 22% from same time last year and 12% year to date. So what have you seen in terms of, it sounds like a lot of users, and then what are you doing for some of the awareness?
Sure. So telehealth is I think it's here to stay. You know, we're living in the age of the new normal. We're conversing via video conference. So the technology is here. Let's put it to use. And certainly in telehealth, I also think that it's here to stay as well. So I think those numbers are going to continue to increase, and we're excited about it. With regards to additional services, we're always looking at improving the services and growing those number of partners that we have on the app.
Yeah, so I have to ask, so at the Doctor Weighs In, we have hundreds of doctors that write for us. And I was thinking, you know, if one of them sees this interview, how do you get care providers to become part of the FindCare app and offer their services?
Well, right now, I'm more than happy they can reach us through Contact Us. They can reach us through LinkedIn. We can connect them to our sales team or some of the folks that we have who interact on a regular basis with the various health systems and the partners that we have and the providers that we have.
So they can, sounds like they could email you or your team directly and get set up if they were really interested in being a part.
Absolutely. But at the moment, as you know, where the partners that we have are through health systems as well as through local regional entities. We not necessarily. Don't want to give the illusion that individual physicians are connecting to us directly at the moment.
Yeah, which is helpful when it's a large health system because they can meet the demand of a lot more folks.
Absolutely.
Okay, so one of the things I also wanted to touch on is we just had an article on the Doctor Weighs In about making patients feel special. And, you know, admittedly, I went to the Walgreens Instagram site, and it seems like it's a lot about making patients feel special, which I love. So kind of how does telehealth, how is it helpful for folks? And have you had any user feedback about, you know, what we're talking about, feeling special, making it easy, all of those things?
Sure, absolutely. Uh, we get a number of consumer feedbacks from time to time. If you think about you're home, you're ill, and you just can't reach your normal physician. Um, Walgreens FindCare makes it easy for you to connect to perhaps with a national provider such as an MD Live or an MWell, where uh, they'll chat with you about your condition and diagnose and provide treatment. So those are ways that consumers who at whatever time it is, or you're in a foreign city, you're traveling on business and you're not sure, and I'm not talking about today where, we're all staying at home, but previously when we were able to do frequent traveling, that's one of the frequent anecdotes that we would get is of people uh, going to a foreign city and not knowing who to reach out to for healthcare. And so Walgreens, having a local Walgreens and having Walgreens on your phone, making it easy to reach out to someone that they can trust, and the care is affordable, is extremely alleviating.
Yeah, it's well, I have a small little anecdote, but one of my friends, he thought he might have had COVID, texted me, and I just told you about all of this new information and the numbness of it, and I don't know where to recall it.
Mhm.
And I was like, shoot, how do I help him? I remember seeing some emails and you'd hear about COVID testing all the time, but when you actually need it, it was kind of alarming to me that I didn't know exactly where to go up front. And so when I downloaded the Walgreens app, I was really shocked at how easy and almost like, peace of mind it brought, even though I'm not sick.
No, no, absolutely. When you think about Walgreens and you think about over 9,000 stores, and we're almost in every corner of the U.S., having familiarity, it's kind of like traveling when you travel to a foreign country and you see McDonald's and you're like, oh my gosh, there's a McDonald's that
Yeah.
all of a sudden you're at ease. So I think it's the same way with Walgreens, except now you can have Walgreens in your pocket through with your app. So that's one of the ways that we can make it easy for individuals to connect and receive care, trusted care as well.
Yeah, well, the Dr. Weighs In is excited to be interviewing you, and a very small part of what you're doing. Some of the things I was thinking about with telemedicine is even rural Americans. Walgreens is in every corner, so it sounds like a telemedicine app like this might be beneficial for folks that don't have access in the, maybe 60, 90-mile radius. They could use this, correct?
Absolutely. Can't emphasize enough that with the days that we're living in with COVID-19, so it's not just the fact that you're remote and you're staying at home, but if you're busy or you're in a rural area where finding care, immediate care or urgent care is just not readily available, it's comforting to be able to have telemedicine directly from home. And so to be able to dialogue and talk to a trusted professional, almost just the same way that you would have a face-to-face visit with a physician's office at a physician's office, is extremely comforting and alleviating.
And what is your advice for a health news site like us? And I did some research with who uses telehealth, and a lot of it seems like younger women use it more frequent than other age groups, but also gender. What would you suggest we do in order to raise the awareness and make it really easy for the people that probably need it most? To recognize that it's easy and here's how you do it. So any suggestions for what I might do when I'm reaching out to our audience about getting them to sign up for this?
Sure. I think one of the benefits, as you said, you echo the demographics, is it seems to be that more doesn't necessarily be the millennials, but younger generations or people my age who are looking for care, convenient care. All of us have smartphones today, so I think it's relevant for anyone and everyone who has a mobile device or a computer working from home. So I think one of the ways that we do that is communicate that, you know, telehealth is is part of the new normal, I should say, and you can certainly receive care from a distance, from a trusted provider, and a name that you can trust. Because I think it's important to actually reach out to entities who've sort of done a little bit of the vetting for you, and that's what Walgreens has done. Is the providers who are on there and the services that we offer are from trusted sources. So I think it's important to know where you're receiving healthcare and who's providing that healthcare, and that it's a trusted resource.
Yeah, that's a great point. So my last question, how is Walgreens telehealth different from, you know, any of your competitors? And I think you may have just touched on a point with it being a trusted source.
Mhm. Yeah, absolutely. So when you think about the comprehensive offering that we have, number one, you know, you think about the journey, you know, from a consultation. I'm not sure what's going on with me. I've got this scratchy throat. I've got a bug. Or is it a bug? What do I have? We'll connect you with a trusted resource. So depending on your geographic location, you may recognize the name of the provider. You know, that familiarity is important. Once we'll connect you to that provider, and if they provide treatment or care or diagnosis, you can also have your prescriptions filled at Walgreens. So from an end-to-end journey perspective, we offer a comprehensive solution. Moreover, you think about the pharmacy. If you're not able to drive, similar to what we talked about a little earlier, you can have your prescriptions delivered to you at no cost. So we have a pharmacy chat is available 24 hours, 7 days a week. So we will help to answer any questions that you may have. Even when you think about, let's say you're traveling to a foreign city and you're not sure what vaccine to have, you can ask our pharmacists, and they'll more than happy to share with you what you need to do for if you're traveling overseas. Of course, all of us are sheltering in place, so there's not a whole lot of traveling, but it's something to keep in mind.
Yeah. Well, I should have done this interview in bed so I could really drive home the message that you don't have to leave your bed if you're sick, because your prescription can come to you. You can get your doctor's appointment right there. So that's really cool.
It is.
So I think that's my questions. The last one I have, and it sounds like you've already answered it a few times, but just to confirm, the doctors can write the prescriptions when they're seeing you. And does that cover mental health as well?
Well, we do have a mental health providers or services. So if you're, you know, ranging from dermatology, MD Live offers mental health, as well as some of our other providers also offer mental health services. So if there's a prescription that needs to be, you know, provided that it's all approved, yeah, absolutely. We'll be more than happy to fill the prescriptions.
Great. Well, I'm really excited to write about this and hopefully help you, even if it's just a very small portion of your business, because I don't think enough Americans know about this. And again, I told you I prepared for this and did some statistics, but I don't think enough people are using telehealth services. And so whatever we can do to help raise the awareness, sign us up.
No, absolutely, and we're excited as well, and we think the future is extremely bright. You know, with regards to telehealth. You know, 10 years ago, not as many of us were carrying smartphones. Now we all do. So we're video conferencing as we speak. So it's a business, you know, conversation, but telemedicine, telehealth is certainly fits into that realm of possibilities.
Well, thank you for all that you've done on the innovation side at Walgreens and for bringing it to us consumers. And I really, again, I appreciate your time. I know that you're probably really busy. So it was an honor to be able to speak with you.
Well, thank you so much. I hope it was helpful, insightful, and hopefully you don't have to do too much editing, but.
Yeah, it sounds like we were good.
So great. No, thanks for having me. I appreciate
Great.
it.
Thanks so much, Jude.
You bet.